What if an AI could be like a guardian angel for every single patient in a hospital? Something that could prevent dangerous medication errors before they even happen. Well, that's exactly what we're going to explore today. A system designed to save lives by seeing the hidden connections that humans can sometimes miss.
So let's start with a number that's hard to ignore, $30 to $50 million. That's how much a single hospital can lose every year because of something called adverse drug events. These are basically harmful and often preventable reactions to medicine. But honestly, behind that absolutely staggering number is a price that's so much higher.
Because for a patient, the cost isn't measured in dollars, it's everything. So to really understand how this technology works, we're not going to just talk about data and algorithms. We're going to follow the story of one person. We'll call her Sarah, and her story shows us exactly how this AI can connect the dots that are so often hidden in plain sight.
Okay, so what exactly is this hidden danger? Well, it doesn't start with some big, obvious mistake. It starts with a series of what look like totally routine decisions, the kind of calls that are made every single day in a busy hospital. So here's Sarah. She's 68 years old, and she's been admitted for a heart condition. On her first day, she's prescribed warfarin, which is a really common blood thinner. No big deal. Then, 2 days later, a different doctor prescribes aspirin for some chest pain. Again, a perfectly standard treatment. So what's the problem? Well, here it is. Warfarin plus aspirin can create a huge risk for major internal bleeding. In the chaos of a hospital, that critical connection can easily get missed. So the real question is, how do you get the computers to see it? Before any AI can step in and help, it needs a complete, crystal-clear digital picture of the patient. The problem is, healthcare data is famously, notoriously messy. It's all over the place. So the very first step before you do anything else is to solve this massive data problem.
And this slide really nails the challenge. A hospital could use what's called a data lake. Just think of it like a messy garage where you just dump everything. Lab results, doctor's notes, prescriptions. It's cheap, yeah, but it's pure chaos. The better way is something called a data lakehouse. Now, this is more like a modern, smart warehouse. You get the same cheap storage, but it comes with this brilliant organizational system that knows where absolutely everything is. And that is absolutely essential for dealing with the messy mix of medical data.
And getting that data ready for the AI is kind of like refining gold. First, in the bronze layer, you just pour in all the raw, messy data from everywhere. Then you move to the silver layer. This is where you clean it up, you standardize it, so that, say, 5 different spellings for the same drug are all understood as one thing. And finally, you get to the gold layer, which is this pristine, beautiful, analysis-ready dataset. You just can't have a smart AI if you're feeding it messy data.
All right, so the data is finally clean and organized. That's a huge step. But the next move is where the real intelligence comes in. You have to teach the system to understand the relationships between all those different pieces of information. And the way this is done is with something called a knowledge graph. Now, don't think of a spreadsheet or a database. Think of it more like a giant, dynamic mind map of all the medical knowledge, with the patient right at the center. It builds all these connections using these simple little 3-part statements called triples. For instance, Sarah, that's the subject, takes, that's the relationship, warfarin, that's the object. Simple, right?
And here's where it gets really cool for Sarah. The system creates one connection. Sarah takes warfarin. Then it already knows from a huge drug database that warfarin interacts with aspirin. So when that new prescription for aspirin comes in, it adds the final piece. Sarah takes aspirin. And boom. All of a sudden, a dangerous little triangle is formed. A connection that a normal database would almost certainly miss.
And the end result of all that incredible complexity is this beautifully simple, life-saving alert. The system connected the dots. It saw the danger. It turned a whole mountain of data into a single actionable warning.
But, just detecting a problem as it's happening, that's only half the battle. The real goal, the true game changer, is to predict the risk before it becomes a problem. And this is where the AI's predictive muscle really flexes.
Just look at the speed here. It's incredible. The very moment that aspirin is prescribed, at 2 p.m., the AI starts crunching the numbers on her new risk profile. Just 1 minute later, it has a prediction. And only 2 minutes after that, an alert is in the hands of the clinical team. This is real-time prevention in action. And what does the AI predict? This: an 87% probability of Sarah having a major bleeding event. Now, this prediction isn't a wild guess. It's based on that new drug combo, her age, her recent lab results, the whole picture. It turns a vague sense of danger into a concrete, quantifiable risk that you just can't ignore. But an 87% risk is still just a number on a screen. And for a doctor to act on it, they really need to trust it. And trust, especially in medicine, comes from understanding the why behind the number.
I mean, this is the classic black box problem with AI, isn't it? A doctor, a highly trained clinician, isn't just going to blindly trust a number spit out by a computer. They need to understand the reasoning. So how does this system actually provide that transparency?
Well, it uses this incredible technique called SHAP values to basically break down the risk and show its work. So as you can see, this is the opposite of a black box. It clearly shows the doctor that, hey, the warfarin prescription is the single biggest factor here, adding a whole 28% to a risk. But it also highlights that our recent lab results are another major contributor. This is what we call explainable AI, and it is absolutely crucial for building trust.
Okay, so now the doctor gets it. They understand the risk, but that's only half the story. The next critical question is, what's the most effective thing I can do to lower that risk right now?
And the system provides a what-if scenario. It's called a counterfactual explanation. It gives the doctor direct advice on the most impactful action they can take. In this case, it literally says, if you stop the aspirin, Sarah's risk will drop from a critical 87% all the way down to a much more manageable 35%. This isn't just a warning anymore, it's clear, actionable, clinical guidance.
Now, Sarah's story is powerful, but it's really just one example. The true, mind-blowing potential of this technology is scaling this intelligence across the entire healthcare system so that every single patient is protected.
And here's how the system scales up, through a brilliant method called federated learning. This allows the AI model to learn from data at hundreds of different hospitals, but without any of the sensitive patient data ever leaving its home hospital. It's a groundbreaking way for the AI to get smarter and smarter while completely 100% preserving patient privacy. And the projected impact is just staggering. We're talking about a 30% reduction in preventable medication errors. That means so many fewer patients like Sarah are ever put at risk. Doctors getting, on average, a 10-hour head start. And yeah, let's bring it full circle. The system can save a hospital about $40 million a year. That's money that can be put right back into patient care.
So, let's just end on this thought. What if every single patient had a digital guardian angel watching over them? A system that never sleeps, that's always connecting millions of data points and seeing the hidden dangers that even the most dedicated and skilled doctor might miss. That's the future this technology is building. A future where patient safety is proactive, not reactive.